Welcome everyone. So now we are going to discuss two topics of neonatology. These are Meconium Aspiration Syndrome and another is transient tachycardia of newborn. So we will compare both of these because these both resemble each other. So we will cover this table, and in this table these both topics will be covered. So the first topic is Meconium Aspiration Syndrome. As word indicates, meconium aspiration. When meconium is aspirated in the baby, it creates problem, and that is known as meconium aspiration syndrome. Now, definition of meconium aspiration syndrome is meconium is first is stool in the maternal fetal gut, and it is acute. Its aspiration creates acute respiratory disorder in which aspiration of meconium occurs into the airway of the fetus and neonate. Now, what happens? Meconium is first stool of the baby. When this first stool is aspirated from the baby, and it in dislodge into the lungs of the baby, that condition is known as meconium aspiration syndrome. So in this way, the distress created, and that is known as meconium aspiration syndrome. Epidemiology of meconium aspiration syndrome is meconium is often passed as consequence of distress in hypoxemia, and fetal term become more frequently at 42 weeks of gestation. Presentation: the baby will present within 12 hours of birth and progress to tachycardia, flaring, grunting will be there, rales and ronca, and chest examination will show barrel chest. Now baby will have tachycardia, means increased respiratory rate will be there, and flaring, nasal flaring will be there. The nostrils will flare up, and grunting sounds will be heard in the respiratory system of the baby. Rales and ronca will also be observed in chest examination. Now, ABGs will be performed in the patient shows significant hypoxemia, decreased oxygen concentration in the blood, and hypercapnia, means increased carbon dioxide concentration in the blood. Chest radiography will show the area of patchy atelectasis, coarse irregular densities, and a hyperinflation. How can we treat the meconium aspiration syndrome? For treatment, mechanical ventilation is mandatory, and a concentrated O2 is given to maintain the airway pressure of the baby. So oxygen supply for chest and lung, and a mechanical ventilation is given. How can we prevent occurrence of meconium aspiration syndrome? By removal of oropharyngeal or tracheal meconium in the baby in delivery room. So when meconium is removed from the trachea of the baby, baby can be preserved and saved from meconium aspiration syndrome. So this is meconium aspiration syndrome, in which meconium, which is first stool of the baby, is aspirated, and the baby develops distress. And now coming to the transient tachycardia of newborn. As word indicates, transient means sudden, tachycardia means increased respiratory rate, is known as transient tachycardia in the newborn. It is condition in which pulmonary edema occurs because of delayed clearance of fetal lung fluid. What happens when fetal lungs are filled with fluid, and when there is delayed clearance occurs, so baby develops transient tachycardia of newborn, TTN. So this condition is known as transient tachycardia of newborn. Now what happens? It occurs in both term baby as well as preterm baby, because in term babies fluid may be in respiratory system, and in preterm baby may be present with immature development of lung. And it is more common in infants in delivery via c-section. Those baby who are delivered through c-section, they are more prone to develop transient tachycardia of newborn. In delivery takes place before the onset of labor. Now presentation is shortly after birth. Baby develops tachycardia and occasionally grunting and nasal flaring. Respiratory acidosis will be there in the babies with a decreased pH and increased carbon dioxide concentration in the blood, with mild to moderate hypoxemia, decreased oxygen concentration in the blood of the babies. And clinical features will be prominent perihilar streaks will be there, and increased interstitial marking fluid in the interlobar fissure will be there. So these are the indicative of transient tachycardia of newborn. Now treatment will be oxygen should be given in the babies, and continuous nasal positive airway pressure should be maintained. In this way we can treat the babies of transient tachycardia of newborn. And its prevention is not known. Still, an incidence is lower in babies born vaginally as compared to those who are delivered via C-section. So, babies who are delivered through C-section are more prone to develop transition transient tachycardia of newborn. So C-section is most important risk factor for this disease. So now we compared both of disease. One is Meconium Aspiration Syndrome and another is transient tachycardia of newborn. So main difference is here in presentation. This presents within 12 hours of the birth, and this presents shortly after birth with the tachycardia. So in this way, we can differentiate the meconium aspiration syndrome as well as from transient taking of the newborn, and we treat the patient according to the presentation and complaint of the mother of the baby. So in this way, that is the topic, and in next videos we will also discuss other topics of neonatology.